Okay, hi everybody. We're just about to get started with the webinar. We'll start in about minute and a half. We're gonna try to start on time at 8 o'clock. Well, maybe we'll give stragglers just a few minutes to get in, but we'll get started with the introductions right on time. Just a second. I'm trying to. We're just about to get started. I'm just going to try to see if we can make sure that our presentation is going to go live to YouTube as well. So let me just futz with one of the little technical things, and we'll see if we can get that going. Hi, everybody. We're just about to get started with the webinar. Today's webinar is going to be on balancing shelf exams and step 2 level 2 exams. We're just adjusting one technical issue so we can get hopefully get the YouTube live, so it records and posts this to YouTube at the same time. So just give us a second while we try to organize that. My name is Marcel Brus-Ramer. I'm one of the co-founders of Elite Medical Prep. I'm going to help host this webinar, and we're really lucky today to have two additional tutors joining us, and we'll introduce ourselves just in just a second. While we're getting set up, I just want to be sure everybody knows that there's a Q&A function, and there's also an ability to chat. But the best way to post things to us is via the Q&A. Already there's a question. I guess people are familiar with Zoom webinar, and it says, ask, will there be a recording available today? There should be a recording available. We're hoping to have a recording both via YouTube and via Zoom. It looks like the YouTube live function may not be working, but we'll still have a recording. So we will definitely have a recording, and we'll send that out via an email, a follow-up email that will go out that's scheduled for tomorrow. Okay, let me just double check that we're ready to go, and then we can get started. Okay, looks like we're going to get started. Thanks for joining us tonight. This is the Elite Medical Prep webinar. We're going to be talking about balancing shelf exams and the step 2 and level 2 exams today. My name is Marcel Brus-Ramer, as I mentioned just a minute or two ago. I'm the president and co-founder of Elite Medical Prep. I'm also a board-certified neuroradiologist. I completed my training at UCSF a number of years ago, and I've been running Elite Medical Prep since that time. Today, we're really lucky to have two of our very experienced tutors joining us. We have Garrett Westcamp, who's a tutor and a graduate of Case Western University School of Medicine. And we have Janet Tam, who's a graduate of Touro University College of Osteopathic Medicine. As we can see listed here, Garrett's going to go into internal medicine, And Janet's going to be going into diagnostic radiology. Woohoo, radiology. I think that's the best field for those of you who haven't yet chosen. But Garrett, you may disagree a little bit. In any case, we're going to be presenting the topic as we mentioned. I think we have some great stuff to share with you today. So without further ado, let's move ahead with the to our first slides. So I just wanted to talk briefly about Elite Medical Prep. As I mentioned, this is a company I helped found a number of years ago. Elite Medical Prep has been focused on specializing in tutoring for the COMLEX and USMLE exams, as well as the shelf exams. And of course, we're going to talk about that today. We also have tutoring services for the MCAT and for post-residency board certification in a number of different specialties. Our team, as you can see already, is comprised of a number of MDs, DOs, MD candidates, also MD PhD candidates, and we've worked with many thousands of students across the US, throughout the Caribbean, and in many other foreign countries. We also have many strong partnerships with medical schools across the US and abroad. And so some of those relationships include some of the schools you see listed here. I will highlight Mount Sinai and UNLV, where we run the official USMLE courses for the students of those schools. And so today we're just going to discuss some high yield tips on how to balance preparation for the clinical shelf exams and also for step 2 and for level 2 exams. Okay. So I think let's get started with an overview of the exams for step 2 and level 2, and maybe we'll have Garrett sort of talk briefly about the USMLE step 2 and sort of take us through some of the basics so we're all on the same page. We understand where we'll some broader topics. So Garrett.
Definitely. So the step 2 exam, not too much different than the step 1 exam, if you're familiar. Step 1 has 7 blocks of questions. Here we actually get an extra 40 questions. So we have 8 blocks of questions, still an hour to do each block. A total of an hour break time, 45 minutes dedicated with 15 minutes of a tutorial that can be skipped. So an overall 9-hour exam day experience. And while step 1 is really focused on the etiology and pathophysiology, the basic science of disease, step 2 is really about clinical medicine, about diagnosing and those sort of first steps of treatment of a lot of the common diseases. If we look at the circle graph over here to the right, we see that instead of breaking things down by organ system, we like to break things down by clerkship topic. So the majority of content on step 2 is going to be internal medicine, a large chunk of surgery, pediatrics, still not an insignificant amount of OBGYN and psychiatry. And you may notice things like neurology, emergency medicine are missing from the wheel, but keep in mind, every single clerkship experience is represented in the questions. These are just the majority of questions that you'll see on your exam day.
Okay, excellent. So we've talked now, Garrett, that was a great overview of USMLE step 2 and so the basics. Let's switch and let's talk about the COMLEX level 2, because we know that there are probably many of you out there who are also taking COMLEX level 2. So Janet, you want to sort of walk us through this?
Yes, thank you, Garrett. That was a great introduction. Basically, the COMLEX 2 is very similar to the step 2, but it has that added OMM component, as you see here, circled in red. And that actually makes up a big chunk of this exam. And I think in total, there is about 20 to 25% of OMM content. If you include the integration into the different subjects, like OMM integrated into internal medicine or OMM integrated into surgery, etc. And you'll notice here on the right side, the timing of the level 2 exam is going to be different from the step 2. But we'll see in the next slide, it's when we compare it side by side, it will become more obvious. And we can talk about it then.
Yeah, I can advance that for you. So here we go. Janet, go ahead.
Yeah. So as you notice here for the step 2, there is 8 blocks of 60 minutes per block, and you're allotted 60-minute break time, which you can use between each block, and you can allot it however you want. But the COMLEX 2 level 2 is a little bit different in that there are 2 4-hour blocks, and you can only take a 40-minute break in between those 2 4-hour blocks, and the other 20-minute break time is going to be spread out after every 2 blocks. And so because of that, it's also important to keep that in mind and pace yourself while you're doing the level 2 exam.
Yeah. So clearly there are a lot of similarities here, but there are some subtle differences and important to keep note of those, particularly if you're going to be taking both of these exams or you're taking one or the other of these exams. We're going to switch to the next slide, and we're sort of now sort of talk about the NBME versus the COMAT, and these are the clinical shelf exams. So I'm using the terms, and of course we're throwing lots of different acronyms at you, but maybe Garrett and Janet, we can walk through this again. Want to get everybody on the same page with regards to the shelf exams, because we've just talked about the differences between the big exams, obviously the USMLE Step 2 and the Level 2, and the COMLEX Level 2. So Garrett, maybe you want to talk about just the shelf exams from the NBME.
So, right, we just covered the Step 2 exam, which you're likely going to take after finishing all your major core clerkships. This is getting into the actual clerkship exams themselves. We call them the NBME shelf exams. So for the MD students out there, you're going to be taking the NBME 110 questions, still 1.5 minutes per question, ends up being 2.25 hours for that exam experience. And each of your shelf exams is going to focus on that actual rotation. So internal medicine, surgery, pediatrics, et cetera. Keeping in mind, though, that questions of all types of patient populations, like pregnant patients, will show up across all shelf exams, as well as all types of diagnoses. So you'll have neurologic diagnoses on your internal medicine and your surgical exams. So there's a lot of overlap for all of these exams, which is why one of our biggest points today is that as you're going through each clerkship and as you're studying for each shelf exam, you're really studying for Step 2. The only other thing I'll add in is the scoring is a little unique for the NBME shelf exams. You get an EPC score, essentially just a number on a scale from 0 to 100, that is a representation both of how many questions you got right, but also how difficult your question set was. So it's very likely that your question set will differ from your peers at your same medical school. And they account for those differences in questions based on about, on average, how many questions, XYZ students got right. So you get that score, which your school will then use to compare your performance to your peers within your cohort.
Okay, so similarly, for the COMAT is kind of the DO version of the NBME exam. And so it's a little bit longer at 125 questions, and you're given 2.5 hours. And what is unique about it is that each COMAT includes some OPP or OMM content in it as well. And the scoring, instead of based on a percentage, it's actually, the mean is at 100 and the standard deviation is 10.
Yeah, and so again, you have to keep in mind of these different scoring systems that are being used here. Of course, you're only going to be taking one type or the other, depending on your medical school. There's not going to be a situation where you're taking both. But in both cases, the scoring system here, of course, is different than the actual USMLE or Step or level. It's USMLE Step 2 or COMLEX Level 2 exams. So just be aware of this differentiation. And it's a little bit. Each of them have their little quirks, as Garrett and Janet pointed out. We already have some, as I noticed, just we're about to proceed to the next slide. We already have some questions that are being put into the Q&A portion. We're going to try to answer some of them during the presentation, but we're also going to be saving time at the end for questions and answers. So definitely put those questions in along the way, because we're gonna definitely have a lot of time to do Q&A at the end and answer all questions regarding this presentation and additional things that our tutors can talk about with regards to these tests. So keep typing those questions in, and we'll try to answer them along the way, some of them along the way, but we'll try to save a bunch of them for the end where we can share the answers to everybody and answer them live. Okay, so we've talked about COMLEX, we've talked about the Step 2 and Level 2. We've also talked about the shelf exams for both the corresponding medical schools and tracks. And basically what we want to do is just sort of get everybody on the same page, and that's something that I think we're all familiar with, and what Garrett sort of hinted at and Janet, of course, mentioned, is that studying for the shelf exams is essentially studying for Step 2. The material overlap is tremendous. A question that you take on a shelf exam is basically a question you're going to see, you could potentially see on your Step 2 or Level 2 exam. So we need to think of these as a preview for these exams. Remember, every question on the shelf exam could in fact be a question on the Step or on the Level 2 exam. And obviously, by preparing comprehensively for those shelf exams, for these exams that we'll be taking throughout our clinical year, this is going to help us during our dedicated period when we prepare for the Step 2 and Level 2 exams. Of course, as we mentioned, everything that's on the shelf is essentially fair game on the Step 2 or Level 2 exams. There are some topics that are sort of technically they're sort of missing within formal shelf exams. such as bioethics, biostats, quality improvement, but these can actually show up on the internal medicine shelf exam. And actually, they represent a pretty significant percentage when you add them up. So we should just be thinking of these as you know, as a sort of a sneak preview of what's going to happen. The shelf exams are going to get us prepared, and how we're doing on those should be a good sign for how we might be doing as we're moving towards our step 2 and level 2 exams. Okay. So with regards to shelf exams, I think let's focus on maybe a discussion on some of the key resources that we need to use for these. And Garrett, maybe you want to start with the MDME stuff, and then Janet will have you talk through the stuff for the COMAT.
Definitely. So I think our best resources for step 2 in the shelf exams are going to be the ones that prep us for both at the same time. And you'll see in this nice little table here that for the majority, that's going to be the UWorld QBank, as well as AMBOSS QBank, if you're familiar or use that. So our recommendations are to always use these step 2 resources for your shelf prep, and then you'll also be reusing them once you get into your actual dedicated period. So if we look down the list of clerkships listed here in the table, there are some nuances that we have listed here that you may want to pick up on in specific clerkship exams. So for internal medicine, I really like the Step Up to Medicine. It's a textbook, sort of like a first aid-esque textbook that covers all of the major diseases and managements. For surgery, Pestana's is sort of a like surgeon's guidebook, fairly short, I think a couple hundred pages that goes over all the major surgical diseases. There's not a particular one that I know of for peds, though there are certainly some out there. For OBGYN, UWise is actually another QBank that some rotation sites will give access to students for. I wouldn't say it's any better or inferior to UWorld. It's just another QBank with great OBGYN questions. For psych, Jen, I think you did first aid for psychiatry, right? Do you want to give a brief little liner on that one?
Yeah, sure. So I really wanted to include first aid for psychiatry for psych because it's really a phenomenal book. Usually I wouldn't recommend using books for studying for step 2. I think usually QBanks, like Garrett mentioned, UWorld and AMBOSS is more than enough. But this first aid for psychiatry, it's very well organized. And it's very easy to follow along. So I think that it's really great addition for psych. And a lot of students that I've worked with really liked this book.
Awesome. And then lastly, for family med, using all of your internal medicine resources is going to be very key. It's a lot of the same diagnoses, but more of the primary care for them or the chronic management of those diseases. And then also the USPSTF guidelines and the CDC vaccination schedules. And then sort of the last thing I'll say here is that when you're using these resources, specifically the QBank, the goal should be to complete 100% of those questions when you're in the clerkship. So you should do all of the internal medicine clerkship questions prior to that shelf exam. That's going to make sure that not only do you score good or score well on that shelf exam, but that ideally you carry that knowledge into your dedicated period as well. We'll talk about sort of how to study, and we have a calendar that we're going to go through at the end of this session as well that's dedicated more so towards the step 2 or level 2 process. But for your actual shelf studying, you should be making sure to complete those questions, making flashcards along the way on any sort of weak learning points. We love sort of making sure students take into account the nice little 2 or 3 liners at the end of any UWorld question to make sure you get really what the point of every question is getting at, and then dedicating, between 3 and 6 hours a week on actually going through your flashcards and utilizing any sort of maybe video or textbook resource. The majority of your time should be spent doing questions, but those guiding resources are always going to be helpful to enhance your knowledge too.
Okay, excellent. So Janet, I'm going to have you maybe add a little bit more. We're just going to run through some of the differences for preparing for the COMAT. Obviously, a lot of this is similar, but why don't you take it away and just sort of lead us through it?
Yeah, and as you can see here in this table, it's very similar, but instead of AMBOSS, if you were to use a second QBank resource, I would recommend COMBank or COMQuest. And I know that most DO schools will provide COMBank to their students, and it is through TrueLearn. And as you can also see here, there is one difference in that we DOs have to take the OPP COMAT. And the one resource that I would definitely recommend is the OMT review book by Savarese. And a lot of students know it as the Green Book.
Yeah. And yeah, this, as you can see, the resources here, very similar throughout. We're also we're not trying to overwhelm you with resources here. We've thought very carefully about this. We've talked to a lot of our team about what these resources should be, and these are our recommendations. Of course, everybody has their own specific personal decisions on what they prefer to use and so on. But remember, you only have so much time during your clinical rotations, so you really don't want to go crazy with too many resources. You want to try to limit it down. And this is going to be a theme you're going to see carried on later on when we discuss resources for step 2, level 2. Okay. Janet, maybe you want to talk to us a little bit about the day in the life, and sort of lead us to the beginning of this slide.
Yeah, of course. And a lot of my students ask me, how should I plan out my day when I'm studying for the shelf? And how does that carry on to step 2 or the level 2? And so I always tell them that shelf exam prep relies on slow and steady practice. You have to start early, start slow, and it's a slow and steady wins the race in this situation. You need to find ways to squeeze micro study sessions during the day in, as Marcel will talk about a little bit later on. And so another big thing that we like to emphasize here at Elite Medical Prep is that we prioritize active learning. And that's why we keep talking about Q banks and that flashcard techniques. So we really like active learning over passive learning, and passive learning are, for example, or reading or videos. And the most important part, I think personally, is you must take practice tests to identify your weak areas so that you can target them. So especially during your shelf exam, so that, when it comes time to your level 2 or your step 2 exam, you're ready for it.
Yeah, no, these are excellent points. Janet. So I guess so putting these in practice. Imagine you are in the middle of your clinical rotation and you want to do some daily shelf study. Let's come up with a daily routine. So I just sort of plotted out something that worked for me. I think Janet and Garrett agreed a lot of these things work for them, depending on it depends on sort of your setup, how close you are to the hospital, whether you drive or not. But in general, we can sort of split up our day into an early morning commute, clinical rotation, say first half, and the lunch break period, which we almost always have clinical rotation in the second half of the day. Then you even commute in dinner time. And almost all these times offer an opportunity to get some shelf studying and, of course, also some step and level 2 studying done during the day. So one way to handle this might be in the early morning, you do a mini set of Q-Bank questions, or maybe do a 10-minute flashcard review. I like to call this coffee and questions. Not exactly the most appealing thing for everybody to have to wake up and have their morning coffee and then do those questions. But you get in that habit of doing, say, 3 to 5 Q-Bank questions. Do them in tutor mode, do them time mode, however you want it. And then, of course, review them quickly. If you do them every day or almost every day, you're going to accomplish a lot. You're going to accomplish a lot in terms of Q-Bank coverage. Remember, as Garrett pointed out, we want to get 100% Q-Bank coverage. Actually, we want to go more than 100%. We're going to talk about this over and over. We want to do all the questions in our Q-Bank and then do them again. So using this early morning routine will help you. It'll also help you on your rotation, because it'll start to alert you to things about your rotations. Remember, those Q banks, especially year-old, have fantastic explanations. So it's a really great way to learn material quickly. So then, you've had your coffee, you've done your mini set of questions or done your flashcards, you have your morning commute. You can listen to something if you're driving, or watch if maybe you're riding a train or a bus, or doing some other form of transportation. You can watch a video or listen to one of those podcasts that are available. There are lots of them, and we can talk about these at the end of the webinar. So great way to get maybe some passive learning in, and this is a great use of that. During your clinical rotation, you may have quite a bit of downtime. Not every rotation is as intense as, say, your surgery rotation. So you might have time to work on flashcards, do some mini sets of questions. But at minimum, I think you can at least edit your flashcards. So you can do those that are focused on your rotation. During lunch break, your lunch break might be quite long. I remember some lunch breaks were kind of extended sort of into an hour and a half longer, or so on. Some are, very short, like on surgery. But again, you could do a mini set of questions, as we mentioned at the beginning of the day, or flashcard review. You have your afternoon, try to squeeze in some additional review at that time. Maybe do some more formal review if you really have time off. And then, of course, even commute, same thing, more passive resource, listening or watching, depending on how you make that commute. And then dinner time. I know you get home, you want to just sort of do your own thing. It's time to catch up on your shows or just catch up on life and other things. But if you can, try to squeeze in every once in a while a small Q-Bank block. Maybe do 10, 20 questions. Doesn't have to be every day, but at least a couple times a week. And voila, you're going to complete your QBank usage. So these are just some ways to do that. And we can talk about this in more detail at the end of the webinar. And it'd be great if anybody has specific questions about this or anything else we've presented so far, just put those into the Q&A, and then we'll start to address these at the end of the webinar. Okay. So I want to also now transition to something. We talked about this, and I think it was alluded to by Janet and also by Garrett. And it's a theme we're going to keep talking about over and over. And that is the discussion of active learning first and passive learning after. So we put together this slide, and this is a slide we've shown in previous webinars that talks about the concept of how we want to sort of prioritize our resources. We created this pyramid here, and at the base of our pyramid, it's sort of our foundation of learning. We want to put questions and the question review at that bottom, and that means that not that it's the least important, but actually it is the most important. It's the foundation of what we're going to be doing. We want to focus our time and our best energy on doing questions and review. And the reason why is because these are active learning resources. These are ways that we're going to constantly push our knowledge and sort of help find the weak spots and teach ourselves in a more efficient and more effective way. If we had infinite amounts of time, then we could read and watch videos until we got up to speed. Remember, we only have a limited amount of time. And so questions and the review of those questions is really going to be the most effective method. Another great method that's active learning is flashcards. Flashcards are kind of a form of mini questions. And so that would be our next thing in our sort of pyramid in our foundation. As we move up this pyramid, you can see with visual memory aids, there are a lot of different companies that do that. I think Sketchy is one of them. These, again, are kind of a form of flashcards. They kind of overlap with videos. And then at the top, we have our videos and reading. And these are things we kind of want to limit a little bit because they're less active. So they can be great to fill in gaps, but we really want to use them after we've prioritized the use of the more active stuff like questions and flashcards. Okay. And so, and this is something that's maybe a little bit more different than what you're used to in the traditional method of where we would read and then do questions. Now we want to say, do questions first, do flashcards first, and then do the reading and watching videos later. Okay. Okay, so I think let's switch gears to talk more formally about some resources for step 2 and level 2, and it'll probably incorporate some of what I just talked about. Garrett, do you want to take it away?
Yep. So we've already talked about, the premier form of studying that you should be doing is questions, and the two QBanks that we really believe in are UWorld, and the Amboss QBank is a great supplement if you want additional questions outside of UWorld. Next, we have a nice little picture of our Anki app here. So keeping that spaced repetition with flashcards that you make is always ideal. There are some of those pre-made decks out there which can be geared towards your clinical year. If you're not the type to make your own flashcards, I think either would be helpful, but making your own is always just one step a little bit better to make sure you really get the gist of all the learning points. And then lastly, we listed a few other sort of comprehensive resources. It is nice to have a guiding resource that has all of the knowledge that you really need to succeed on any given clerkship or for the actual board exam you're taking. So for me personally, that was the online med ed video series. I would preview the videos and then jump into my UWorld QBank so that I had at least some context on, let's say, how to interpret jaundice, how to interpret indirect versus direct hyperbilirubinemias. And then doing questions immediately afterwards actually helps to solidify and make sure that I apply that knowledge instead of just passively view it. So our entire presentation is going to be on trying to make sure there's active learning at every step of the way. And if you're going to start with video learning, my mentality is always make sure to follow it up with some sort of active learning right away, whether that's flashcards, making some flashcards based on those videos, or ideally jumping straight into UWorld questions on those topics. So we have the online MedEd video series. Then we also listed the first aid for step 2 CK book there. Just another great, very thick though, textbook size resource with all the major diseases, management steps, complications that you need to know for your exams.
Great. And for level 2, instead of Amboss, we recommend COMBank, as mentioned before. And I agree with Garrett. Online MedEd is a great video resource for those who are looking for more of a visual aid to supplement their questions and their flashcards. In addition to that, another video resource that I do recommend is also Dirty Medicine on YouTube. He has a whole series on osteopathic medicine, and a lot of students find that very useful to see it, visually and explained in a video format.
Yeah, These are great. And again, we see that there's a tremendous similarity here between the resources for step 2 and level 2 and for the shelf exams. We're sort of beating a little bit of a dead horse here, but this is the thing. It's there's so much overlap between these, just a matter of utilizing those resources in slightly different ways throughout the year. I think we've talked a lot about resources. Let's sort of jump into maybe some common pitfalls and how people are preparing and maybe some solutions for those. So maybe hey, Garrett, you want to lead us through this first slide of pitfalls and maybe some problems and solutions we can have?
Sure. So students often tell me when they're asking for advice on the shelf studying versus the actual step studying, should I be saving questions so that I have new questions when I get into my actual dedicated period? And our mentality is that the best preparation you can do for step 2 is to best prepare yourself for the shelf exam. So ideally, no questions are left behind. You do 100% of that clerkship topic while you're in that clerkship. And then once you get into your actual dedicated period, you can reset the entire Q bank because ideally you've done 100% of questions up until that point. If not, that's a good time to actually jump into those other questions or do incorrects on any weak areas. There's a couple ways to tackle that, but it's never going to really hurt you to redo questions once you actually start your dedicated. Keep in mind, your clerkship year is probably about 12 months long. You will have not seen a lot of those questions for about 6 to 12 months. Secondly here, students are a little bit concerned about actually jumping into their step 2 CK studying right at the start of their dedicated, which can be daunting because students often only get about 4 weeks on average for their step 2 period instead of the normal 6 to 8 for step 1. So you might want to start studying a couple months early. And what that might look like is if you're in OBGYN for your last clerkship, but you finished all the other clerkships, maybe soon after finishing the OBGYN questions, you start incorporating mixed questions from all topics. And that's going to make sure that on day 1 of your dedicated, that you're not struggling to grasp information from all of the different clerkships you've rotated through many months prior. Third, we see, students often struggling to actually schedule in their practice exams. Practice tests are really important to help guide and let you know where you're at in the process, especially at this point when you've picked a specialty, you probably want to get a certain score. And I like to have at least 2 scores near that range before taking the exam to help give me some confidence and show me that it's going to be okay when I go in for the real deal. So we always recommend to our students to take a baseline exam on day 1 of dedicated. There's lots out there. And then making sure to schedule in about like 3 to 4 other exams over your 4-week period, likely ramping up probably more so in that last week. Lastly here for my slide, not being productive enough during the studying day. That is a very common problem for medical students. We're tired, we're exhausted. These clerkship days can be really long. Luckily in dedicated, it's the only thing we have to worry about, but sometimes you're still too fatigued. So we always try to prioritize doing the active part of the learning first in the day when you have the most mental energy. So doing all those QBank questions and flashcards probably before noon, at least before maybe 2 p.m., and then saving the evening for some of that video review. So if you're going to be using online med-ed or step 2 CK, the first aid portion, maybe reading that or previewing the videos the night before for the questions you're going to do the next day. And we'll talk a little bit about that when we get into the calendar too.
Yeah, excellent. This is great. Janet, why don't you lead us through a couple of additional sort of problems and solutions and sort of how we can avoid some of these problems?
Yep. So to continue on, another problem that a lot of students come to me with is they're telling me that they're spending too much time reviewing practice questions. And so oftentimes I'll tell them to set a time limit. So for example, if you're doing a set of 40 questions, maybe you'll start with taking a little bit more time in the beginning to review these questions. Let's say an hour and a half, maybe 2 hours max. But I would say that you should aim to, cut down that time to around 1 hour for a set of 40 questions. And so as Garrett mentioned earlier, we like to emphasize reading the learning point or the objective at the end of the question first, and that really is the most important part of that question. And then, so we also recommend spending less time on difficult questions. So let's say if, in the UROAD QBank, this question is, less than 30% of people get this question right, then perhaps this is not a great question to spend all your time on. And we do also encourage you to avoid outside research and Googling. You can really dig yourself into a hole there when you do that. Another problem is a lot of students create detailed study guides by hand to passively read. And so, for example, if I would say that the students who like to take notes in a notebook style format where everything is kind of jumbled up, almost like an essay format. We actually like students to use more active recall techniques, like flashcards instead. That would be more effective to consolidate the information. And for students who spend the majority of the time on passive resources like reading or watching videos, and a lot of students tell me that they like to start with reading or watching videos because they feel like they don't have the knowledge to answer the questions correctly. But unlike step 1, you don't really need all this other outside supplemental information. What you really need is in-UWorld questions and using that first aid book as a reference. So prioritize finishing the QBank. Again, we're going to keep emphasizing that. And as Garrett said, do questions early in the day when you have more energy and focus. So you have more time to get your questions in, and then maybe later on during the day, you can review your questions. And the most important thing I would say is don't ignore your work-life balance. You don't want to burn out. You don't want to study nonstop. You want to give yourself time to breathe, take care of, life in general. And so it starts with lighter prep work several months before dedicated, so that you're taking this more longitudinal approach. And it's important to schedule downtime during your dedicated study as well. Maybe like once a week, you'll take some time off just to, reset or, work on your hobbies or do the things that you like.
Yeah, this is excellent. This is really, really good advice. And I think let's pivot a little bit here. I just want to have Janet talk to those people who are going to be taking COMLEX 2 in addition to Step 2 CK, some specific things that they should sort of consider here. This is something that people like myself who only took Step 2 don't have to consider, but I think in this situation it's important to cover these points just to sort of so you understand some of these additional considerations. So Janet, maybe take it away.
Yeah, definitely. There are some additional considerations that I think are very important. So one is that most schools require you to pass a COMSA exam, which is basically like an MBME exam, but for the DOs. And a lot of schools have a minimum score, and usually it's around 400 to 450 in order to actually even sit for the exam. So you have to keep that in mind. And most of the time schools will require you to take this COMSA exam about 2 to 3 weeks before your actual test date. And for QBank questions, we like to alternate between UWorld and TrueLearn to get yourself familiarized to the COMLEX style. And in terms of assessment exams, I actually like the MBME exams more than the COMSA exams where you're when you're doing these self-assessments, because the downfall about COMSA exams is that you can't review the questions. So without that option to review, I don't think there's, it's very high yield. And MBME is great in that they have great explanations. And so in terms of the timeline of when to take COMLEX, I usually recommend students to give themselves 1 to 2 weeks after Step 2. So during that time, you can give yourself time to consolidate that OMM information. And a lot of students also ask me, what is high yield on the COMLEX 2 that, studying for the Step 2 doesn't cover? And so I would say, obviously, the OPP. And as you can see in this red box here, I've listed some of the more high yield OPP content. So visceral somatics. Visceral somatics covers 20% of all your OPP content on the COMLEX 2. And then the rest would be made up of counterstrain and entrapment points, where your anterior entrapment points are more important than your posterior entrapment points. And then the rest are made up of lower extremity and upper extremity treatment modalities, placement and treatment of the patient. And other than that, I would say that the microbiology on the COMLEX 2 is very different from the Step 2 in that they have some obscure microbio. And so there are Anki decks out there where people have consolidated that information. And also there are more difficult ethics questions, I would say. And there is also a lot of Anki decks that people have made regarding that as well. And as a reminder that the COMLEX 2 timing is a little bit different from the step 2. So it's important to take that into account when you're switching gears from step 2 to COMLEX 2 to know how to pace yourself and time yourself.
Yeah, this is fantastic. So great. So we've covered a lot of ground and a lot of material about the basics of the shelf exams and of the board exams. And now we wanted to sort of shift everybody's attention and towards the topic of how to actually lay out a schedule. And I think this is something I alluded to at the beginning of the webinar, and also we've alluded to in some of our social media posts. Right now, what we're gonna do is we're gonna take you through a series of slides. I'm gonna lead you through, and we're gonna walk through how to actually construct a pretty effective USMLE Step 2 or Step 2 Level 2 study planner. And what we're going to do here is we're going to show actually our new study planner that we've just recently developed and we're just actually releasing. And this is an updated one that it's a 4-week calendar. And so we'll sort of take our time going through this. A good study planner is really key for your dedicated study period. And the key is that we're going to make the most efficient use of our time. I mentioned we recently overhauled these. Previously, our study planners were 6 weeks long, but we realized in discussion with a lot of our tutors that most people only have about 4 weeks to prepare for their exam. That's because they get about a rotation worth of time. It's usually 1 month exactly. So we want to fit that in. And of course, that's a little bit more compressed. So we really have to be really careful with our time, really efficient. And we're gonna do in the subsequent slides, we're gonna sort of walk you through how we actually built this. So you understand, you see this like very busy study planner here, but I want to show you the pieces and sort of show you how we built it step by step. So you're going to see a series of slides, and this is going to, I think, help you understand why we have it laid out as we do. Okay, so our study planner is 4 weeks, as I mentioned. Most schools are going to give you about 4 weeks. I think in future years, we're going to hear from students that they're going to get more than 4 weeks as step 2 and level 2 become even more important, because as step 1 and level 1 have gone to pass fail, these step 2, level 2 are going to become more and more important in terms of residency decision making. But for the time being, most schools we've surveyed have said 4 weeks, some less, but usually this is the amount of time. If you have more time, of course, please extend or just repeat weaker topics and weaker areas. Okay. If you have more than 4 weeks, excellent. If you have 8 weeks, that should be really more than a sufficient amount of time. You can just double this all up. You can do it twice, or you can extend the things by double. But here we have it sort of laid out like this. And we can see we have what we have in our calendar here is week 1, week 2, and we have our days of the week, and you'll see what everything sort of refers to. So the first thing we want to do in this whole process is we want to set our study date. That's going to be day 28 in our calendar. And I'm going to show you what this looks like for those who are taking level 2 and step 2. As Janet has mentioned, she recommends, and many of our tutors or DO tutors recommend, that you take the step 2 exam first, and then give, in this calendar, at least we're going to give a couple days before level 2. Obviously, if you're able to have more time between them and maybe have up to another, maybe a week or so, or even 2 weeks, that would be optimal. But if we're trying to squeeze it all into a 1 4-week period, this would be a great way to do this. Give yourself about 3 days between this. The idea here is that that there's going to be some space where at the end we're going to be able to consolidate some knowledge related that's specific to the level 2 exam, OMM, OPP. And Janet, maybe do you want to add a few comments here before we move on about that squeezing in that time?
Yeah, that was great. So in the 4-week calendar, you don't really have enough time to, you don't really have like 2 weeks to study the OMM content, but I do recommend my students to start studying the OPP content earlier on, sort of taking a longitudinal approach. But going off of this calendar, though, I do recommend a couple of days between step 2 CK and level 2 to really cram that OMM knowledge in.
Yeah. So yes, the broad point here is try to incorporate it throughout, but leave some time at the end to sort of cram that in. No matter, even if that's only just going to be 3 days, which is in this compressed schedule. If you have more time, obviously you can do a little bit more extensive preparation. Okay. So now, once we've set our test date, the next thing we want to do, and according to this calendar, is set up at least 3 practice exams. Now, you've seen throughout the slides preview to this, ideally, you're going to do 4 practice exams in advance of your step 2 or level 2 exam. Practice exams are something that you really want to make sure you do. You do not want to avoid them. This is a common problem that we see students come to us for. Oh, I'm preparing for the exam, but I haven't taken my baseline exam. So in our study calendar, the very first thing you're going to do is take your baseline exam. Then we're going to schedule out our practice exams. We want to put those down in advance, so we're sure we have them listed. So on the calendar here, I actually have 4 practice exams listed, baseline, and then 3 additional practice exams. I think it's important to put those down first before you put down your topics, because we want to leave a lot of time for them and for the review of those. And then of course we already have our test day. So day 1 of your study period should be your baseline. Okay, and then here's just how it would look if we were going to do it for the in preparation for if you're both COMLEX Level 2 and USMLE Step 2. We have a slightly different version of this, and because of the shortened time course here, we've only put 3 of them on here, but you could probably squeeze in a 4th one. It just depends on your specific situation. Okay, great. So now what I wanted the next step in the process here is going to be to figure out, okay, how are we going to break up the remaining days? So the best way that we recommend this, and moving forward in these slides, I'm just going to show the USMLE Step 2 version instead of flipping back between the USMLE Step 2 and COMLEX Level 2 version. So we're just going to stick with this version here, but keep in mind we have 2 separate study planners, one for those who are just taking USMLE Step 2 and those who are taking both COMLEX Level 2 and USMLE Step 2. So we're just going to focus on this one for the time being. So with the remaining time that we have left on our calendar, we have our test date, we have our practice exam set, including our baseline exam. We're going to break up the remaining days by organ system. I think that's really the most effective and efficient way to break up the information. So here we have things listed like cardio, home, GI. You can see at the bottom we have a couple days devoted to surgery, and we have also some dedicated time to OB/GYN. I'm just only showing you the first page of this 2-page calendar. So that's weeks 1 and 2, still weeks 3 and 4, but they're all divided in a similar fashion. We want to also try to emphasize putting key topics up front and things that are your weaker areas for us. So you can adjust this as you need to sort of match your needs. Okay. Now, we've mentioned this over and over and over again, but we're going to say it again here. When we look in a more detailed way at what we're actually going to do in our question bank, what we're going to see is we're going to prioritize active learning. So what you can see if you look more carefully at what we've written here is that in the morning, we want you to do questions. Do 40 questions, maybe do them in tutor mode, then do the review. Always review your questions right after. Try to also incorporate some flashcard creation. Again, then in the middle of the day, same thing, more QBank questions, maybe do them timed, incorporate some flashcard review, and then do your more passive resources, video and other such resources. Remember, do your QBank questions first and always review them right after. And also keep in mind, you really want to use your best mental energy, which is usually the first half of your day, and for the most active learning resources, which is going to be questions. Okay. Now, when we've talked about our morning, midday, and afternoon activities, and these are just suggestions, of course. We're going to talk about now about what we might do in our evening hours. So for our evening hours, we might do some more review of those questions. So maybe you're going to review and redo those incorrect questions. There's no harm in redoing questions. You're just going to learn and master that material more effectively because you're going to learn those explanations, both for the right answers and for the wrong answers. Also, this is a great time to do additional review of flashcards. So this evening time is sort of a time where you're going to do sort of things that are a little bit lower, that require less energy. So redoing your incorrect questions, it takes a little bit less energy. You might also work in here some video and some reading stuff. This evening time is going to be for more passive resources. Also, evening time is going to be a time when you want to strengthen and consolidate knowledge you already have. Okay. Just want to show and highlight and remind you of the slide. We talked about this earlier. Don't need to go through it again. This is our pyramid of active learning first, passive learning after. Core resources, our core things are going to be our question banks and our flashcards, which are more active. Okay. So now that we've talked about all the different components in terms of what we're actually going to do, the last thing we want to sort of show on this calendar is how you're actually going to hold yourself accountable. So a study planner that we have, or any study planner you create or you get anywhere else on the internet or elsewhere from your school or whatnot, is only useful if you actually use it. So to this study planner, we've decided to add a bunch of checkboxes. You can see we actually filled in one of these checkboxes here. Take your baseline exam. So if you feel like it, you can print this out and then you can just check off things on each day as you do them. And that sort of helps give you that sense of accomplishment, build that momentum to help keep going with this, it's pretty grueling and tough period in your exam prep and in medical school. It's really important to try to help stick to your plan. So you can use this calendar, you can use study buddies, you can use friends and family, and you can also use tutors. both Janet and Garrett are two of our really top tutors at our company, and they work with lots of students who part of the role what they do beyond just sort of helping them explain information is help them stick to these really tough schedules during this really difficult exam prep time. Okay, so we've run through these calendars. I wanted to sort of announce everybody that you're going to be receiving in a follow-up email links to download these calendars if you're interested. And of course, feel free to share these with your colleagues, classmates, friends at other medical schools, even administrators if they're interested. So we made them officially available. All the attendees who are at this webinar are going to receive a PDF version of this. And of course, I think if you can't wait until the end of the presentation, I think we're going to be able to post the link to that in the chat during a Q&A. Okay. That is basically the extent of our prepared comments. We wanted to leave a lot of time for some Q&A, and we have a Q&A function. So I wanted to make sure that if anybody out there has questions, you can start posting them in the Q&A component, and then our excellent tutors, both Janet and Garrett, can be available to answer this. I can also be involved in answering some questions here. I've been doing exam prep for a number of years since before I started Elite Medical Prep with my co-founder. So we combined, we have many years of extensive knowledge, and Janet and Garrett are both actively working with students right now who are, I think, in the midst of their COMLEX Level 2 and Step 2 prep. I think we're starting to see questions come in, and I'm just going to give people a chance to start typing their questions in. But I think we can, in the interest of time, we can start going through them. And I think we can start with the first one up here. And Janet or Garrett, you guys can jump in and tell me who wants to go ahead. I guess the first one here is, how well would you say do NBME scores correlate with the actual USMLE scores, be it Step 1 or Step 2? So I think maybe we can talk about it from a Step 2 perspective. And so Garrett, maybe, or Janet, you want to go take it away?
Yeah, I think I can take this one. So if we're talking about the Step 2 exam, I think there is a lot of relationship between the NBME shelf exam score you get and the Step 2 score. Keep in mind, though, your score may fluctuate, maybe 10 to 15 points on all the different clerkship shelf exams you're going to take. And I think the ones that are going to be more reflective of your Step 2 score are going to be those ones that are more represented on the exam. So if you think back to the earlier slides we saw with that little pie chart, internal medicine and surgery make up almost, I think, 60 to 70% of the total exam questions. So if you do phenomenal on those shelf exams, it's likely that you're going to do fairly well on the Step 2 exam. Well, if those are two that you did the poorest in, then I think it is going to require a little more energy to bring your scores up. So my end answer would be they are certainly correlated, but you do have to take into account which shelf topics are actually correlated with the actual question content on the real deal Step 2. Janet, do you want to take the flashcard question?
Yeah, and the question, I think, is what's the best way to review flashcards? So Janet, maybe you want to talk about that? That might be a great
Yeah, so the best way to review flashcards is, as we said, is towards the end of the day, sort of in the evening. And I think the best way to review flashcards is actually making good flashcards, is the way that I'd like to tell my students. You need to make sure that your flashcards are high yield and only important information that you really don't know. And you want to make sure that you're doing it in a spaced repetition format. So for example, something like Anki, where you're keeping yourself accountable to do maybe a certain number of questions per day. And you want to make sure that you're not overwhelming yourself with the amount of flashcards either that you're making.
Yeah, I think those are great. I think another thing that I can add a little bit about flashcards, I've talked about this topic in the past, is what beyond sort of making sure you make good flashcards, also make sure you're editing your flashcards. You may want to get flashcards from an external resource. Maybe you got them from a friend. Maybe you got them from one of those websites or other sources that give you thousands and thousands of flashcards. Remember, a resource is only as good as you use it, and flashcards are something you really want to personalize, and you should have the option to personalize. Whether you use your flashcards through Anki or Quizlet, or you use the really nice integrated ones in the UWorld QBank, you want to make sure that you edit those. And that may even include removing flashcards that you find are just less effective. So don't feel bad about deleting a flashcard. Make sure to edit them. Also, Last point on flashcards, remember a flashcard has to be really limited information. The number of students I've seen who come up with a flashcard that is paragraphs of information. Well, that's not really helpful. You need to be really just a couple bullet points, 2, 3, maybe 4, maximum, I say 5 bullet points on any flashcard. So make sure that you're definitely trimming those down and keeping them short. And if they're too long and you have to, it's must keep information, then just split them into 2 flashcards. Okay. Great. So we have some questions about how early is too early to begin studying. I think that's, and then there's some questions also maybe about the time of the day to study. So maybe Garrett and Janet, you guys want to talk a little bit about this? Garrett?
Yeah, I think in terms of how early is early to begin studying, I think in terms of your shelf exams, students always ask, when should I start studying for my clerkship year? Maybe like right before their first rotation. And, make sure you take good time off before you jump into the clerkship year, because it is a long, grueling year and you have thousands of boards questions that you're going to be doing over that year. So I'd say if you want to actually prep for your first rotation, maybe a week ahead of time is appropriate to just dive into some of the basic content, a week or 2. For the actual step 2 exam, we sort of mentioned earlier on, starting at least a month or 2 ahead of your actual dedicated period by incorporating mixed questions. And you'll see this on the calendar. We have not only topic specific questions integrated in every day, but also mixed questions. And we mean every single organ system, every single clerkship topic, even the QI, the biostats, the ethics, all in a 40 question set, so that you start to learn how to actually differentiate between all of the different diseases. Because if you're only doing cardio and you see a question that has only one heart related disease down there, you're probably going to have a hunch what the actual answer is going to be. But making sure to incorporate those mixed answers earlier on, probably like the 1 to 2 months ahead of your dedicated, is really going to make sure that you understand a lot of the nuances between these diseases and you're not just sort of getting some lucky guesses here and there.
Yeah, Jen, do you want to add anything here? I have a couple points I want to add with regards to QBanks, but maybe you want to anything else regarding that, beginning how early to study?
Oh, I think that was great. You can go ahead, Mr.
Yeah. So I think Garrett touched on the topic of using those mixed sets of questions in your QBank. That's really, really key. But I think one of the things that sort of ties into and the sort of common question that's related and can come up is like, well, I want to save those questions for later. And I want to tell you right now, I think we've touched on it in some of the slides. I'm going to reiterate it here. I've said it in numerous webinars in the past, and of course, live presentations at medical schools across the country. Do not save questions. There are so many questions out there, so many excellent questions. You are never going to be at a shortage of good, really high quality new questions that you can take. But also, just going back, if you've chosen a QBank, say UWorld is your QBank that you're going to use as your primary QBank, doing those questions again is going to be extraordinarily helpful, because when you're doing questions, we're not just saying do the questions, we're saying do the questions and also the review of that material afterwards. It's an active learning review. The value of questions is the questions plus the immediate review afterwards. And so if you master all those questions in the UWorld Step 2 QBank, you also master the information that's associated with them, you will be very ready for the exam. You should be in a great position to score very well on the exam if you're able to master not only the question, but also the explanation for that. And that means the explanation not just for the right answer, but also for all those other wrong answers. So don't save questions. Jump into this mixed review, as Garrett mentioned. Try to start earlier if you can. And of course, in our study calendar, as Garrett mentioned, we have a dedicated time when you're going to be doing mixed review throughout. Okay. So we've answered some questions about that. So there's questions about that are sort of talking about how long does it take to prepare to pass step 2 approximately, and then there's sort of some other questions that are sort of related to that. So and then we'll have some questions that are maybe related to students who have studied abroad, who are basically foreign medical graduates or U.S. medical graduates. But let's maybe first talk about general how much time overall it might take to prepare to just pass step 2. How much time does it's sort of a minimum that we think that would take? Garrett and Jen, do you want me to sort of take this, or do you want me I can sort of.
I was going through some questions in the chat, but I think if you are a US trained MD or DO, you should know if you're close to passing step 2, essentially by your last clerkship, because you will have taken an exam on every single shelf topic and you have passed every single one of those, you have essentially been exposed to about every type of question that's going to show up on step 2. Now, if you are an IMG student, that might not be the same case. So in that instance, I think taking that baseline exam on day 1 is going to be very key, because if you did have very strong clerkships, you retained a lot of your knowledge, maybe you're still in medical school, it's not been a long time since you've been in these rotations and learned this knowledge, maybe you'll pass on day 1. If not, I do think at least a 4-week period is enough to hopefully get you seeing improvements in your score, but always it's going to be very dependent on, I think, every individual's circumstances.
Yeah. Maybe a question for both of you guys also that I think I'm just trying to interpret what people are writing here and try to summarize their questions. The question is, if someone has the option to take both step 1 first or step 2 first, what should they take first and why? Maybe you can elaborate a little bit on that. If you guys want, I can go ahead and give an answer for that, or Janet or Garrett, if you want to jump in.
I worked on a student with this actually recently, a student who was an IMG who wanted to practice in the States in family medicine. And he and I decided together that we wanted him to take step 1 first, because it was only after he actually passed step 1 that he thought was going to be harder for him, that he would then find himself having enough energy to study really intensively for step 2 to get the score that he needed to actually get into the specialty of his choice. So I think it depends on the individual as well, how much actual energy you have to dedicate to studying. Maybe you're somebody who wants to take step 2 first and make sure you get that score before you go back and do step 1. I think it could be done either way, probably dependent on which set of information you feel more comfortable with, the clinical information or the basic science. If you're stronger in one, it might be easier to start with that one. But I would probably, once again, leave it up to the individual and maybe, a mentor of some sort to help you make that decision.
Yeah, my preference, Garrett, might be slightly different. I think given that step 1 is going to pass fail, I might focus on doing step 1 first. There's gonna be a lot of material overlap here. So there's gonna be a lot of coverage on step 1 that's gonna fall into step 2. And because step 1 is just gonna be pass fail, if you can be certain that you're not gonna have any issues with passing that exam, then it's a great chance to just do a run through, get the sort of that all that nervous energy out, and just get a sense for how that long day is going to go, because there's nothing like real exam day. So you do step 1 first, you prep extensively, go sit for the exam, definitely pass it, avoid having any situation where you might fail it, and then go ahead and then do your preparation for step 2. But of course, that depends on your preference and of course your energy level and availability. Okay, great. There's a question that's from a foreign medical graduate, and we'll do one other question. It'll tie in flashcards. Maybe we'll let Janet and Garrett start, but I'll handle the one on for foreign medical graduates. We do have some foreign medical graduates who are attending, and so there's sort of some questions for those who are foreign medical graduates and preparing for step 2. I would say to those people who are foreign medical graduates, step 2 is the new step 1. Please make sure that this is your clear focus. You're going to have to pass step 1 and get that passing score. Make sure you don't fail it, but really, for foreign medical graduates, there's going to be a lot of emphasis here on step 2, because that's the one that's going to provide a numerical score that residency programs are allowed to use to help compare you versus other candidates. Because they may be, the residencies may be less certain about the quality or familiar with your medical school because you're coming from another country. Your strong step 2 score is going to be a great way to sort of say to them, okay, I'm able to perform at the same high level as the other people in that are likely to match in this program. So really want to put a lot of time into it. Of course, if you're in a country where English is not the primary language, or you're not in a medical school where English is the primary language, I think you want to give yourself even more lead time in your preparation, because you want to make sure you're familiar with all the terms. I've met with students across the world. I've presented at medical schools across the world, including a number of them in Europe, and even in the Middle East. And at those medical schools, when I talk to students, I tell them, even though you're learning in English, you're obviously, when you go to clinical rotations, you may be doing things in other languages. You need to make sure you're super familiar. There's no hesitation with any of the terminology. So I think that just make sure to give yourself extra lead time to prepare so you can do well. And if there are options, obviously, for mentorship in these situations that may be very helpful. Okay, I guess let's finish up with our last question that we can get to today, and that might be I guess it might have been answered, but there was some questions about flashcard construction. I just wanted to see maybe if Janet and Garrett, you want to give some feedback about best way to make flashcards or the best flashcard program to use. I alluded to some of them a little bit earlier.
Yeah, so I actually answered this question in the chat, but I would reemphasize that I think making your own flashcards is definitely better than using pre-made decks. And using something like Anki, where you can have spaced repetition, is recommended. And because the process of making your own flashcards in itself is a great active learning technique. And it helps, solidify information. And also by making the flashcards yourself, it's easier for you to look for these flashcards and really understand what the flashcard means to you. And by making the flashcards yourself, you're making flashcards that are, related to concepts that you're weaker on, that you can focus on. And so then you don't have to be overwhelmed by the thousands of cards that pre-made Anki decks come with.
Yeah, no, definitely agree. I think the spaced repetition is really a key component here with regards to flashcards. Any flashcards you use should have an adaptive learning component where it shows you the stuff that you don't know more often than the stuff that you do know. Anki is a great source. I think Quizlet has that feature, and I know that the UWorld integrated flashcards definitely do that as well. They're really, if you really are big into those UWorld tables or UWorld explanations, then that might be one of the best options for you, just to simply build your flashcards as you're doing your UWorld review and use the integrated flashcard feature that they have there, which I think was a relatively new addition and has been really excellent. Okay, I think I think at this point, it looks like we've gone a couple minutes past time. We're expected to be on for about an hour, and we've done that. We've answered most of your questions. I think there are still a couple more questions coming in, but in the interest of time, I wanted to sort of wrap up our recording and make sure that that everybody here has an ability to get our access to our study planners that we showed. Those should be in the chat box. They've been released. They'll also be provided to you in a follow-up email. So I think I really wanted to sort of wrap up with our final slide here, and just to sort of talk about if you have additional questions, or if you wanted to consider potentially getting tutoring or working with one of our tutors, or just getting some mentorship either for step 2 prep or other related exam prep, or even residency advising. I wanted to provide everybody that information here. We have specialized medical education consultants who can meet with you and talk with you. And the way to reach those people and schedule a meeting would be via elitemedicalprep.com/contact. You can also reach us via our email, info@elitemedicalprep.com. And I really wanted to thank everybody for attending today. Also wanted to thank our panelists, Janet Tam and Garrett Westcamp. This is really excellent. I had a lot of fun on this webinar. And thank you again for everybody for joining us. We'll see you around, and please feel free to pose us questions via email, and also reach out via our contact form. Okay, thanks everybody. Have a great night.